You get pregnant, you have your baby, family, and then you're just happy.
I've done this before. I'm a mom of 2. I'm going to be a mom of 3. Very excited about it. Felt like I knew, what was going to happen, what to expect.
So it was my first child, first grandchild. So I was just expecting only happiness.
I didn't think it will have any issues and I would enjoy, raising this child. That's not what happened.
Sometime during or after pregnancy, 1 out of 7 women will develop distressing symptoms. Symptoms linked to a spectrum of illnesses known as perinatal mood and anxiety disorders.
So we're gonna feed you again. It's been a whole hour and 20 minutes.
These illnesses include depression, anxiety and panic attacks, obsessive compulsive disorder, post-traumatic stress syndrome, bipolar disorder, and in rare cases, psychosis. Many factors contribute to the broad range of physical and emotional problems that fall well beyond the baby blues.
The blues is very transient. It comes and goes. Women are up and down. They're sleep deprived. They're adjusting. The blues is normal. The blues is not a disorder. And the blues should be over by about 2 weeks. So if women are still feeling badly or not themselves or having more bad days than good days after 2 weeks, it's not the blues anymore. It's something more significant and more serious.
The symptoms of the disorder vary, but include sadness, extreme worry, irritability, anger, mood swings, changes in sleep patterns and in appetite, and repetitive thoughts and difficulty coping.
The unique parts of your personality should be intact, and any kind of mental process that is altered, your ability to have fun, your ability to relax, your ability to experience joy, that's a warning sign that something's not right.
And as it is with other illnesses, some women are at a greater risk for developing the disorder.
Just like we inherit heart disease, we might be predisposed to anxiety or depression or obsessive compulsive disorder. Maybe we had a traumatic event in our past. That would also add to it. Sexual abuse, physical abuse, any kind of traumatic event that happened, that would also maybe add to our risk factors.
The risk is also higher in women who have a personal or family history of a mood or anxiety disorder, or had a previous pregnancy or postpartum mood or anxiety disorder. Also, women who suffered a pregnancy loss, face financial hardship, marital or relationship problems, and those who lack help at home must understand that they are vulnerable.
Many women I've worked with have really talked about the conspiracy of silence, that nobody feels comfortable confessing how hard it really is or what a rough time they had.
I do remember feeling like I just wanted to go away for like 2 years, just let me go on a vacation and get better, and I didn't want to miss anything. I didn't want anything to change. I didn't want my children to get bigger. Just put everything on hold and come back and be, who I was before. Oh, everybody wants to swing.
They're surrounded by people who tend to give them this buck up message. Just pull yourself together. You have this beautiful baby. Look at this home you have. You should be so happy. And so she, of course, is denied the opportunity to express her feelings.
Experts say that shame and guilt keep women from seeking help, and getting help often requires research.
Can I erase that one? Yeah. Okay, then we'll put those.
What worked for Kim, and for most women suffering from perinatal mood and anxiety disorders, is a combination of treatments, consisting of social support, psychotherapy, and for some women, medication.
It's like if you go to somebody to treat your diabetes and all they do is give you insulin but don't talk to you about managing your stress and your sleep and your diet, then you're not adequately treating the illness. So I encourage women, whether they're more comfortable with therapy or more comfortable with meds or more comfortable with getting social support, that they actually try to open themselves up to be getting all of it.
Whatever treatment is prescribed, families play a key role.
Good job.
Denise says her husband's support was vital.
My daughter, who is 6 months old now, is like this amazing gift because she is living proof that you recover from postpartum depression, that it's not a life sentence, that with treatment, you get well.
How are you doing today? I'm doing perfectly fine. What is your name?
I just feel joy with motherhood, like I did prior to the experience. I'm very glad that I finally gave in and received the help. I'm a better mom and a better person because of it today.